My name is Dawn Webb. I am the program director for the Texas Peer Assistance Program for Nurses, referred to as TPAPN. I appreciate all of you joining our Lunch and Learn. We are going to go over quite a bit today, but I think that we'll have enough time. We do have two people that will be answering questions, Roland Rodriguez, who is our case management team lead, and Katie Davila, who is our program operations coordinator. If you ask a question in the question box, they will be responding to your questions throughout the webinar. Also, if you have a question that does not get answered during the webinar, we will be taking those questions via email at TPAP. The email address is tpapn@texasnurses.org. I will be given that email address again at the end of the webinar. So it's just going to be a brief overview of the TPAPN program, along with several other topics that talk about substance use disorders, mental health conditions, referrals, stigma, and just giving our colleagues support by referring to our program and just learning a whole lot more about TPAPN. So please use the questions tool if you have any questions throughout this webinar. And thanks again for attending. So basically today we're going to do a TPAPN overview. We're going to talk about substance use and mental health conditions among nurses. We're also going to have a discussion about stigma surrounding substance use and mental health conditions. We'll talk about reporting and self-referral, the participation process for a nurse that's participating in TPAPN, and then how to support nurses in their recovery journey. One of the things that I really want to talk about too is the advantages to self-referring before a practice violation occurs, and what participation looks like when someone self-refers. So TPAPN's mission, of course, is to safeguard patients with the emphasis on early identification. TPAPN is devoted to keeping nurses employed, and the program is funded by a portion of every nurse's licensure fee and serves as an alternative to board discipline. We empower nurses through resources, referring them to providers for evaluations. We also have peer support partners that provide support to nurses in the program, and the goal is for the nurse to keep their license and to continue to practice nursing safely. So our mission here, as you can see, the main point is for us to give support and support the individual so that they can practice nursing safely. I did want to talk a little bit about our TPAPN team. I know that people probably don't really know how big TPAPN is, where we're located, all of those things, and we're actually a very small team. We're just made up of 12 employees. Myself, I'm the program director. We have a program operations coordinator, which is Katie Davila, our case management team lead, Roland Rodriguez. We have an intake coordinator, Madeline LaMarche, and she also carries a caseload. We have 6 full-time case managers, 2 case manager assistants that provide support to the case managers, and then we are currently recruiting an outreach coordinator that will serve as a case manager and also do outreach. We have found that we need to do much more outreach. We're located in Austin, and we are responsible for nurses across the entire state of Texas. So this very small team is very small in comparison to the state. We have about 400,000 nurses that live in it, in the state of Texas. And here from Austin, basically all of our communication with participants, communication and monitoring is done through a case management software program and email and telephone. So I wanted to share this because we are very tiny in comparison to the Board of Nursing, and our role is very different than the Board of Nursing. We do not investigate, and we do not take a nurse's license away. I've heard that from nurses before. We're going to take that, they think that TPAPN, that we somehow would have some control over taking a nurse's license away. We absolutely do not have that type of control. We are strictly an alternative to discipline, and we believe in wellness for nurses. We believe in recovery, and we believe that a healthy nurse is a safe nurse, and that's pretty much what we stand for. So again, we're a pretty small group of folks. So meet the new TPAPN. So over the past year and a half, the TPAPN team has worked really hard to become more person-centered and recovery focused. And we also have shifted to language that is more person-centered. Person-centered language plays a very important role in how the program is perceived by our participants and by the community and by employers. So one of the major changes that have taken place over the past year and a half is that we've changed our branding and our entire approach to how we work with nurses. And we've updated all of our program materials, and we've made sure that all of the TPAPN case managers are trained in providing person-centered services and motivational interviewing. Each of our team members, the case managers, actually our entire team has been trained pretty extensively on motivational interviewing. We've done a 16-hour in-person training. We've done some online trainings. And our goal is really to find what the nurse's motivation is in completing the program. We know that a nurse wants to keep their license. We know that they do not want to lose their livelihood, but we also know that they have other goals. So we really try to find out what those goals are and work with them in achieving that goal and helping them realize that as they participate in TPAPN, everything that they're working on not only helps them to keep their nursing license and to practice safely, it also teaches them to live a healthier life. So TPAPN, we empower nurses with substance use disorders and mental health conditions, or both, to make healthy changes and be proactive in their recovery journey so they can practice nursing safely. We've also really focused a lot of our time and energy around reducing stigma. It's really important that we identify that, and I will be talking about that more throughout this webinar. And hopefully each of you can identify any bias that you may have or fears that you may have about reporting and kind of just dig a little bit deeper on why you may or may not report somebody, or why you may be fearful of reporting somebody or fearful of hiring somebody that's part of the TPAPN program. So hopefully we can kind of get into that a little bit more. And just so you know, TPAPN has also, for the last 2 years, participated in the NAMI Walk. That's the National Alliance on Mental Illness, and it is an organization. They have a really great website that supports family and friends of individuals that have a mental health condition. A lot of really good statistics on that website, and just a lot of support there. It is super duper important, especially during COVID, that we really identify the effects on mental health and how we can support nurses who are experiencing any type of mental health symptoms. So our slogan, helping nurses and safeguarding patients, this is part of our slogan. The other part is nurses helping nurses. As I mentioned before, we're devoted to keeping nurses employed, and we encourage early intervention in the workplace as well as self-referrals. This helps nurses avoid practice violations. And of course, I think that that's what we all want. And then the TPAPN case managers maintain a delicate balance between supporting the nurse's recovery and public safety. So on this slide, TPAPN is a person-centered program supporting nurses in recovery from substance use, mental health conditions, or both. This is an evidence-based approach, and we strive to help nurses improve their health and wellness and live a self-directed life, and of course, reach their full potential. And we're also devoted to keeping nurses employed and encourage that early intervention in the workplace, as well as self-referrals. And this helps nurses to avoid practice violations before they occur. Anything that we can do to reduce practice violations due to substance use or mental health, any kind of intervention we can do early, it is definitely helpful for patients and their safety. So currently, we have over 600 participants. about 650 participants right now that are participating in the program. And again, that's a very low number considering that there are over 400,000 nurses in the state of Texas. 90% of the nurses participating in our program are in the program for a substance use disorder or both a substance use and mental health condition. 10% are mental health conditions only. We perform over 13,000 drug tests a year, and the last average was about 4% positive tests a year. That has increased since the COVID pandemic to about 7% during our last quarter. So we'll have to look at each quarter to see what's going on with that, to see if that number is going up or down. And again, TPAPN is an alternative to board discipline. We safeguard patients and support nurses in the recovery. I obviously can't say recovery enough. That is what we're about. And it's all about a nurse recovering, practicing safely, and just rejoining the workforce if they've been out of the workforce while maintaining their wellness. And that could be attending recovery groups, different types of support groups, just whatever they need, therapy, counseling, wellness activities, and that could include yoga, exercise, journaling, any type of wellness activity we encourage. So now we're going to talk a little bit about substance use disorders and mental health in the workplace. And I really hope that we learn more about substance use disorder and mental health in the nursing profession so that we can have that early intervention and get nurses the help they need and avoid practice violations. And again, if a nurse is healthy, if we really focus on the nurse's health and the nurse's wellness, it is a natural consequence that the patients will be safer. If someone comes to work, they're healthy, they're doing everything that they need to do to maintain their health, to maintain their wellness, just to be in a really good place, it makes for a much better nurse working with an individual, working with families. The public really picks up on the stress that nurses carry, and we have to really focus on that wellness piece. And we want nurses in the workplace, whether it's a hospital setting, whether it's a doctor's office, or any type of organization where a nurse is working. We really want nurses to have that wellness. We don't want to have to fake it through our day and act like we're okay when there's all these stressors. That's how mistakes happen. So again, these go hand in hand. If you have a healthy nurse, you have a safe patient. So I just want to really make sure that I emphasize that. So substance use disorder, so it's estimated that about 10 to 15% of nurses may be actively impaired or in recovery from drug or alcohol addiction. This is an older statistic. These statistics are hard to find. It's nursing research related to nurses with substance use disorders and mental health conditions. It's definitely under researched, so we need to get more research in this area. So this 10% statistic aligns with the average US statistic for adults affected by substance use disorder. So you have to imagine how many nurses in the state of Texas that may be affected by a substance use disorder. If the average person, non-nurse, just person in the United States is about 10%, and then we're saying 10 to 15% of all nurses may be actively impaired or in recovery, and then we need to look at our 600 that we're serving right now at TPAPN is a very low number. So there are probably a lot of nurses out there that need our support. And whether it's support through TPAPN or they go out and get help on their own, as long as that nurse is getting help is what we really, really want to happen. So we're serving less than 1%. It's about actually a quarter, 0.25 of 1% of nurses. All right. Sorry about that. So the odds of a nurse not reporting a coworker for suspected substance abuse while at work were 5 to 1. So think about that, not reporting a coworker. The odds of a nurse not reporting a coworker, 5 to 1. Not good odds. And then nurses enrolled in an alternative to discipline program have nearly double the retention rates of nurses involved in disciplinary programs. So that's really a shout out to alternative to discipline programs. So now we're going to talk a little bit about mental health conditions. This comes from NAMI, the National Alliance on Mental Illness that I had mentioned, that we do the NAMI walk every year. So these statistics are not specific to nursing, but we realize that nurses face several mental health and psychological challenges, including anxiety, compassion fatigue, depression, ethical issues, and secondary trauma. And that's just to name a few. So you have these statistics of just an adult in the United States, 1 in 5 US adults experiencing mental illness each year, 1 in 25 adults experiencing serious mental illness. And then you have the suicide rate, second leading cause of death among aged 10 to 34. We have a lot of nurses that are, early 20s through that age of 34. And then more statistics, 19.1% of US adults experienced mental illness in 2018. And then 4.6 experienced serious mental illness. And then you have 3.7 of US adults experiencing a co-occurring substance use disorder and mental health condition in 2018, which was about 9.2 million people. So as we do more research, we've learned that also that nurse suicide has not been adequately measured or studied in the United States. So we need more research on that, and we are beginning to gather data, and that data indicates that nurse suicide is underreported. And unfortunately, they have research on doctor suicide rates. They have research on first responders, police. You can find a lot of research on all of those professions, but there's very little on nurses. So if anyone is in school right now and needs to do a research project, that would be a really a good research project to do. Because the truth is that nurses are susceptible to the same suicide risk factors as the general population, and then also maybe an increased risk due to the challenges that I've mentioned. And then more research is needed definitely in this area. So now I want to look at some workplace risk factors that contribute. So workplace risk factors, of course, access, work overload, role strain, lack of support, burnout, poor coping skills, attitude toward drugs and drug use, and then also enabling, and isolation. So I mentioned the psychological challenges on the last slide, but this list of workplace risk factors is long but not exhaustive. So we're aware that there are many stressors that nurses encounter in the workplace, especially now with the COVID-19 pandemic. But the stressors of the pandemic go way beyond what we have ever imagined, that the trauma that nurses have experienced. And we talk a lot about secondary trauma, but with COVID, it's not even secondary trauma, it's direct trauma that nurses are experiencing during this pandemic, because the role that nurses have taken on has been the role of, not only are they the nurse, they are also taking the place of family members that can no longer see that patient. So the nurse is that person in the middle who's like taking those phone calls and kind of acting as a liaison. And sometimes they're that person that the patient, it's the last person that speaks to that patient on behalf of the family. And that's really hard. And then as we look at what's going on with the increase in COVID cases and COVID deaths, this death toll, the increase in the death toll is just very, very traumatic for nurses to experience. And nurses are really taking the brunt of what's going on with COVID. So we really have to look at these risk factors and then think of, you have these risk factors all the time, but now we have COVID added to it. So it's so important that leaders, peers, organizations, that we are really paying attention to what's going on with nurses, and that we're supportive, and that we're really talking about mental health and wellness and finding ways to support nurses. I can't stress that enough. And we have to incorporate compassion in our approach to the subject of substance use disorders and mental health conditions. We can't come at it from an angle of it's a some type of character defect. It is not a character defect. It's something that just happens. No one wakes up one morning and decides that they want to be addicted to drugs or experience depression. So we really have to be compassionate in our approach to how we handle when we do recognize that a nurse is having difficulty. So let's look at some of the warning signs. So typical warning signs that you would see just with anybody, nursing, non-nursing, would be attendance and performance issues, suspicious behavior. Sometimes you'll see that someone's appetite and sleep patterns change, of course, some personality changes, mood swings. Motivation tends to decrease when someone is using substances. Also, the person may be fearful, anxious, or even paranoid. Those are some of the behavioral changes. And then you have physical changes. And those physical changes maybe you may see someone with bloodshot eyes, abnormal sized pupils, sudden weight loss or gain, the deterioration of physical appearance. So you might see a peer or a employee, another nurse, who at one point in time, they were always really well groomed, makeup on, hair done, all of those things, and they may start to kind of maybe not wearing makeup, maybe their scrubs aren't clean or they're wrinkled, they're just kind of thrown together. And that can also just be a sign of a nurse being very tired too. So we don't want to mistake that for a substance use disorder. But yeah, the deterioration of physical appearance and then unusual smells on breath, body, and clothes. And then, of course, social changes, sudden change in friends, hangouts, and hobbies. Legal problems are definitely something that we see. And then the unexplained need for money or having financial problems. So identifying these warning signs and intervening early safeguards patients, obviously, but it also helps nurses, it prevents practice violations. And again, that's what we want, because a practice violation is always a patient safety issue. So recognizing these common signs that you may see and appear, you need to really recognize those and then make that decision on what the next steps are going to be and how you're going to support that person. And which, again, we'll talk a little bit more about referrals later on in this presentation. So workplace warning signs, and these are specific to nurses, medication and documentation errors, poor charting, many mistakes, large number of wasted narcotics, an obsession with the narcotics or Pyxis machine. You may see someone who's, just overly anxious, overly paranoid, that's maybe around the Pyxis machine, trying to kind of cover their tracks. Maximum use of needed pain medication for patients. That's definitely one of the warning signs. And then frequent reports of patients not getting adequate pain relief, altered orders, and then dishonesty around orders or what's going on. Maybe the nurse is unable to explain certain situations when asked. And sometimes these can be very simple explanations, but they may appear to be more nervous and unable to explain simple errors. So early intervention, again, recognizing early warning signs before a practice violation occurs is really important. So peers and employers who recognize the early warning signs should encourage the nurse in question to self-refer to TPAPN before a practice violation occurs, rather than overlooking the signs that may lead to patient neglect or harm. So if you suspect substance abuse, you are required to report the nurse to TPAPN or the Board of Nursing, depending on the circumstances. And again, we'll get more heavy into that later. It is important, though, that if suspicion alone is enough to report someone to the Board of Nursing. So if you suspect someone has a substance use disorder, that reporting is required. And again, I'll talk a little bit more about that as we move forward. And then here's a resource. I'm not going to play this video. It's a 12-minute video. I feel like everyone can do this on their own time. And I will give you this link to this video again at the end of this presentation. But it's a really comprehensive. It looks at the issue of substance use. It does a walkthrough with a nurse, kind of a scenario of a nurse who is experiencing a substance use disorder. It shows, it has some facts about substance use disorder specific to nurses, identification and reporting, how the investigation and intervention might look in the workplace. It talks a little bit about treatment and alternative discipline programs, and then recovery and return to practice. I do encourage you, again, I'll give you this link again to watch this video. Watch it with your peers, watch it with your staff, maybe have this as a video in a meeting that everybody can watch as a kind of a team activity to really kind of emphasize the importance of reporting. And again, the National Council of State Boards of Nursing, really good resource. This video is a great resource, and then they have little handbills that you can have mailed to you to hand out to employees. So now I want to talk about stigma and attitudes towards substance use disorders and mental health conditions. And it's really important, now that we've discussed some of the statistics and warning signs, it's really important that we discuss stigma. It's really important that we discuss this before we talk about reporting, because stigma is really what keeps people from reporting it. It's also what keeps nurses from self-referring. I'm not going to get too heavily into this, but I just really want to emphasize stigma is out there, it is real, and it is really, really important that we identify if it's in our workplace. So some definitions. Obviously, stigma, it has its 3 different types of stigma. It's everywhere. It's structural, and that's the societal and institutional manifestation of attitudes and beliefs that interact with people on different levels. And it perpetuates kind of a prejudice and discrimination. And then you have public stigma, which is just the general public, like something that's out there that's stigmatized. Everybody knows it's stigmatized. It's also within subgroups and first responders, clergies, those kinds of folks. My background before I became the program director at TPAPN was with Integral Care, the local mental health authority here in Austin, and I worked with individuals that were experiencing homelessness. A lot of stigma there because substance use disorders and mental health conditions are prominent in that population. So the stigma with that population was the assumption is that this individual is homeless because of their mental health condition or their substance use disorder. And that is not necessarily the case. People who have houses also have substance use disorders and mental health conditions. So we can't really say that, you know, someone's homelessness or someone's substance use disorder, that somehow they go hand in hand. Now they can do, it definitely contributes, but we have individuals who are housed, we have individuals, nurses, non-nurses, high ranks, low ranks, you know, it does not discriminate. And I think that that's the one thing that we really need to always keep in mind. Stigma is real, and substance use disorders and mental health conditions, they do not discriminate. They will, anybody, anywhere can experience a substance use disorder or mental health condition. So I just want to make sure that you all are aware of any of your own bias and take time to dig a little deeper into your own feelings on the subject. We all have feelings, we all have our own experiences that we bring to the table. And as nurses, we are taught to kind of look at our, well, we are taught not to kind of, but to absolutely look at our own bias and to learn and to dig deeper and to educate ourselves. So we need to always keep in mind that, that substance use disorders do not discriminate, and mental health conditions are an illness, just like any other illness. You know, diabetes, asthma, it's an illness. It can happen to anyone. It's not a reflection of someone's character. And until we truly understand this, we'll stay stuck in a place where substance use disorder and mental health conditions are hidden. And that's the last thing we want in nursing. We don't want nurses to hide what they're experiencing. We want them to seek help. So being aware that these both substance use disorder and mental health conditions carry the stigma, that awareness is really important, and we need to find ways to overcome stigma and help those who need the support. So another interesting part of nursing is that nurses have a very specific kind of attitude towards substance use. Nurses are knowledgeable about drugs, and they believe in drugs to promote healing. So they can easily apply this to themselves. So if you look at this slide, nurses, so this should really say nurses' attitudes towards substance use. Substance use is seen as an acceptable means of coping. Faith in drugs as a mean of promoting healing, a sense of entitlement by a nurse that they need to continue to work and can lead to rationalization of substance use as a means to an end. So long hours, night shifts, those kinds of things. It's almost like this badge of honor when a nurse is overworked and tired. It's like, oh, I just worked, 57 hours. We take pride in that, but at the same time, when you take pride in overworking yourself or working too many shifts or too many hours or taking on too many patients, that pride that we carry is very unhealthy and can lead to very unhealthy behaviors, including using substances as a means to cope, as a means to be able to work that many hours, to stay up all night, those kinds of things. And then you also have the special status of healthcare providers as being an invulnerable population to the illness. So nurses may believe that they're invulnerable to addiction or to the same illnesses of their patient. So they may think that, I can use this substance and I'm not going to become addicted. And then you also have to look at the fact that nurses have professional training about powerful medications and how they can use that to self-diagnose and to self-medicate. So those are some of the attitudes that we find in nursing. So we have some ways to reduce stigma, and I do want to remind all nurses that there is the American Nurses Association's scope and standards of practice that talks more about our responsibility to cultural diversity and inclusion principles. I kind of want to incorporate that with the stigma piece because it is our responsibility to make sure that we, again, recognize our bias, that there's not stigma in the workplace, and that we're being transparent. So ways to reduce stigma in your organization is to develop a culture of transparency and support. Also creating a culture of safety where healthcare workers can candidly approach each other about their concerns. So that open, honest conversation, and then creating an environment that encourages reporting. It's vital to reducing the stigma and maintaining transparency, and then also to rehabilitating the nurse and protecting the public. And then also nurses need to talk more among themselves and examine their complicit code of silence. It's called the don't talk rule, and this infiltrates nursing units. A lot of times we'll find that nurses think, well, it's not really my business. That nurse is doing okay at work. I don't really see many problems, but I do see all these warning signs, but there hasn't been a practice violation. So should I say something? Should I do something? We should absolutely say something. If you are questioning whether you should say something, you should say something. And that's just kind of my rule of thumb. Anytime in nurses, and as nurses, we know if you're starting to question an order, like, this order this seems off somehow. We're not just going to go with it. We're going to question that order. We're going to ask questions. We're going to move forward with that and not just go with the flow. We need to do the same thing with one another. If we're identifying that something's wrong, or we think kind of in the back of our mind that something looks different, it probably is. So just make sure that you're not avoiding the referral process or avoiding talking about something because of your own fear, own bias, because that does affect our ability to reach out and to support nurses in need. So some barriers to getting help pointed out here. There are multiple fears of why nurses wouldn't want to get help: fear of job loss, fear of losing a nursing license, of course, that professional respect, and then just the unknowns that come with recovery. And then there are also feelings of shame that are attached to substance use disorders and mental health conditions. Shame, embarrassment, and the embarrassment and the shame is attached to stigma. And then, here are several barriers. Stigma is listed here: embarrassment, poor coping skills, lack of education, lack of employer support. And that's why I want to emphasize this so much. Employers have to find a way to be supportive and to be able to work with nurses who have substance use disorders or mental health conditions. There's too much at stake not to. And of course, patient safety is always the number one priority. But we also need our nurses. We need our nurses to be healthy. So leadership responsibility. Leaders have the ability to create a culture of safety within their work teams. And some of the things that can be done are listed here. So increasing camaraderie and trust among your team, raising awareness and appreciation of the differences and strengths in others, finding ways to strengthen relationships among the team, improving team communication, creating tools to navigate tough moments and challenging communication, and then supporting those diverse relationships. So as leaders, we have a responsibility to make sure that we're doing everything that we need to do to create that culture of safety, like I mentioned before. And it goes with transparency, it goes with trust, again, looking at diverse relationships, and really just digging a little bit deeper and talking openly and having those hard conversations. I know that, we don't always have time in our work schedule to have, team meetings and activities for, team building, those kinds of things. But if you can just take a few minutes to talk about stigma, to talk about wellness, and to talk about trust and reaching out for help and reminding nurses of the available resources, like an employee assistance program, or if your insurance has certain tools that can be used to promote wellness. And here's the code of ethics that I was talking about. So to help shift culture and remind nurses of their ethical obligation, all nurses and nurse leaders need to read all of Provision 3.6 in the ANA Code of Ethics, because we're dropping the ball when it comes to looking out for one another. TPAPN, our main slogan is nurses helping nurses. And that's, nurses really need to look out for each other. We need to have each other's backs. And it doesn't matter, where you are at in a hierarchy. You're a brand new nurse, or you're, been in the nursing profession for, 40 years, you're in a leadership role, you're an executive, associate's degree nurse, bachelor's, master's, DNP, we're all nurses. So we need to look out for one another and just take pride in being nurses and taking care of one another. And being ethical, we have to understand that, we do have a code of ethics. And this provision, is really interesting. So basically, I'm going to read it. Provision 3.6 in the ANA Code of Ethics for Nurses discusses extending compassion and caring for colleagues throughout the process of identification, remediation, and recovery. It also discusses supporting the return to practice of individuals who have sought assistance and after recovery are ready to resume professional duties. So we want to support nurses who have gone through the process. We have employers who out there, unfortunately, who do not hire nurses that are participating in TPAPN, which is really sad because these nurses have already gone through the process. They've gotten an evaluation. We know what's going on with them. They're being drug tested. They're doing everything they can to be well and to stay sober or to keep their mental health symptoms in check. And they're doing the work. So if they're doing the work, why wouldn't we support that and give them that opportunity? And one thing that I do want employers to think about with nurses that are participating in TPAPN is that this nurse is being monitored. They have a case manager who's monitoring them. They're checking in every day. There's random drug testing. So you have a nurse who, first of all, is going to be really committed to that organization for giving them the opportunity to continue to work there or actually maybe get the job there. It's like, oh, you've given me this opportunity. I've gone through this recovery process. You're here to support me through that. There's a lot of loyalty in that when a nurse gets that kind of support. And then you, if you're in a leadership role at a healthcare organization, you know this person is being monitored by TPAPN. And we do get consents to speak with employers so that if there's ever a positive drug screening, we immediately reach out to that employer and we have the nurse refrain from practice until we can figure out what's going on. So we have safety measures put in place to ensure that the nurses that are in TPAPN are safe to practice. And as soon as if there's any indicator that that nurse is not safe to practice, then we immediately pull them from work. So reporting. So the main thing that I want to really point out on this is that reporting is an act of compassion and it may save the nurse's life. So it's more about saving their job and their livelihood and their nursing license. This could save their life because we all know that substance use without some type of intervention leads to one or two things: the loss of freedom or the loss of life. So you have to think about that. If you don't report and this nurse continues to use, substance use only gets increasingly worse. It is a chronic illness. So we have to intervene in order to save that person's life. So it is an act of compassion. And if we lead with compassion and rid ourselves of stigmatizing behaviors and language, reporting is the kindest thing that we can do for someone who's experiencing a substance use disorder or mental health condition. It is truly an act of kindness. So the Nursing Practice Act of the state of Texas, section 301.402, which I'll give you that information, states that a nurse has the responsibility to submit a written signed report to the board when he or she has cause to suspect wrongdoing by another nurse, and failing to do so is a violation of the act. So if someone needs help, what could happen if you don't, and who should you be concerned about? So here's the Nursing Practice Act that I mentioned, and reporting is required. All states and territories legislated by the Nursing Practice Act establish their own administrative rules. And then there's also regulations that are consistent with the NPA. So the rules and regulations of each state have to be in compliance with the NPA, consistent with the NPA, but don't go beyond what the Nursing Practice Act dictates. So we do, with reporting, we have multiple types of referrals. We do really like when nurses self-refer because that's early intervention. But we do have third-party referrals that come straight to TPAPN. We have third-party referrals that go through the Board of Nursing. And then, of course, we have nurses that come in on board orders. So as I said, reporting is required to TPAPN or the nursing peer review if a nurse is impaired or suspected of being impaired by chemical dependency or mental illness, and there's no Nursing Practice Act violation. If there's a Nursing Practice Act violation, it would have to go to the Board of Nursing, but you can make a referral to both TPAPN and the Board of Nursing. It gets them in TPAPN quicker. If you make a referral to both, but reporting is required. If suspicion, so please remember that if you suspect, and you can look on our website tpapn.org for more information about referrals. Again, it's required to the Texas Board of Nursing if the nurse's practice is or is suspected of being impaired by chemical dependency or diminished mental capacity, and the person believes or suspects that the nurse committed a practice violation. Remember, anytime there's a practice violation, you must report to the Board of Nursing. Anytime there's a suspected substance use issue, disorder, you must make that report, even if it's just suspected. So just want to make sure that I'm clear on that. And you can look at the Nursing Practice Act 301.410 to get more information on that. And again, you can go to our website. And the Board of Nursing website has an abundance of information. So just looking at the Nursing Practice Act and put what you're looking for in this search and it'll take you right to it. So how do you choose TPAPN versus the board? So here's the breakdown on how to choose. Basically, what we do, TPAPN, helping nurses, safeguarding patients, we provide guidance, support, and monitoring. We may be an alternative to discipline, and then we have that social peer support piece. And we also have added some recovery supports to our program. And then you have the Board of Nursing, they do the investigations, the monitoring, and the discipline. So for nurses with mental health concerns only, we focus on following and supporting so the nurse can demonstrate their ability to safely practice nursing in a highly stressful workplace environment. So with mental health concerns only with no substance use disorder, that participation does look a little bit different than if someone is participating because of a substance use disorder or a co-occurring substance use and mental health condition. So referrals, so TPAPN referrals, written, confidential, and they are not anonymous. Anonymous referrals, we can't take anonymous referrals. And then the referrals can come from a self-referral, so the nurse themselves, third-party referrals, and the Board of Nursing. Referring early to TPAPN connects the nurse immediately to support, care, and accountability. We try to get our referrals processed within 7 to 14 days. And that means intake is done and they're assigned to a case manager, a letter is sent to them, and we make a phone call to them letting them know that they've had that referral. So self-referrals, there are numerous advantages to self-referral. Definitely self-referral, there has to be no practice violation, and it makes it the best way, of course, for a nurse to engage with TPAPN. Self-referring can help nurses alleviate other financial and logistical requirements. It helps nurses avoid a board order. Evaluations, they have to have an evaluation when coming through TPAPN so that we can get that diagnostic information. Many times if they still have insurance, that evaluation would be covered by their insurance. And then we may be able to use prior evaluations or diagnostic information just depending on how thorough that evaluation is. And we also ask that nurses don't wait until license renewal to self-refer to TPAPN, because any time that they've completed it in TPAPN prior to license renewal, when they say that that they have a mental health condition or something going on, that time and that self-referral is really beneficial to them and looks really good. The board really supports TPAPN and supports nurses that are in TPAPN, and really like to see when nurses intervene on their own and do that self-referral early. So participation. So here is just a quick graphic that provides an overview of the TPAPN process. It begins with the evaluation, and you see where it says nurse experiences substance use. They're referred to TPAPN. The needs are determined through an evaluation. The nurse is then assigned to a case manager who supports them, and daily check-ins that have to happen. They connect the nurse with additional support, including the evaluator, where they have to get the evaluation, therapists, chemical dependency counselors, and any other providers that are needed to meet their recovery. So this is just a little graphic of what participation looks like. And then this is our TPAPN matrix. This is how we assign the nurse the program that they're going to be participating in. And this is all based on the evaluation. So the success of nurses participating in TPAPN is dependent on a competent, complete, and thorough substance use and mental health evaluation. So this matrix was implemented in January of 2019. And it allows for TPAPN to have a more robust program. It makes it more person-centered. And TPAPN participants are placed in different tracks and tiers based on their diagnostic information, remission status, the severity of their diagnosis, and license type. Participation needs are determined also by the referral information, toxicology test, and any type of treatment that they've already been engaged in. And then we also do get information from the Texas Board of Nursing. And then often nurses, the participants do need who need practice monitoring. We work closely with employers to make sure the participant receives the support that they need in the workplace. So we talk to employers, we get employer reports, we approve jobs. So we do have active communication with employers and make sure that that employer knows what that nurse needs. So participating, again, this is that chart just all summed up. Evaluation, random drug testing, determination of fitness to practice, whether they need treatment. We do provide peer support. There's monitoring, of course, with and without drug testing. Returning to practice, we get provider releases to return to work. We get authorizations. Just so much is involved, all the things that we do. All the way from the very beginning of that first phone call when we talk to that participant, all the way to completion. So it's a pretty remarkable process. So abstinence is required for nurses participating in TPAP, and they do sign an abstinence statement. And here we have abstinence from all abusable drugs, including alcohol in general, is a requirement for participation. So narcotics are strongly discouraged with the understanding that there may be medical necessity. If a nurse has surgery, some kind of chronic pain issue, TPAPN is not, we do not take the place in any way whatsoever of what a doctor recommends for their patient. So if a doctor is recommending that a nurse need a narcotic pain medication for something that has happened, we are not the doctor, so we never try to dictate or take on that role. We trust the physician, but we do make sure that the nurse is practicing safely, and we do get medication reports that we have to review. Any medications that a nurse is taking while they're in TPAPN, we do have to have a medication report form for that medication. And we have to know exactly what it's for, how long they need it. And in many situations, a nurse will not return to work. And again, this is probably could be a surgery or something like that until their doctor has released them back to work and safe to practice. So the focus for the participant is, of course, on their recovery, on self-care, and then on maintenance and demonstration of their sobriety and mental fitness. So the self-care piece goes beyond attending recovery groups. It's about all the other things you can do in between going to your recovery group. Long-term recovery is daily work, and that's something that we really try to emphasize in our program. So some of the participation goals, of course, them getting the evaluation, if they need treatment, recovery and support activities, of course, sobriety and drug testing. And then the participant is going to have communication with their case manager, their peer support partner, and their employer. And again, for nurses with mental health concerns only, we focus on following and supporting the nurse so that they can demonstrate their ability to practice safely. So we look at the mental health, we just want their mental health to stabilize. So recovery support. So we have peer support partners. These are nurse volunteers who may or may not be in recovery. Some of our participants that have graduated from our program are now peer support partners, which is pretty awesome. These peer support partners, they have a desire to give back to the profession. We do teach for our peer support providers, we do have workshops that talk about person-centered support and motivational interviewing. We do ask that they have regular supportive communication and that they're inspiring hope. And then the peer support partners also do send quarterly reports, which are really important for us to know how that nurse is doing. And something really cool that we've engaged in the past few months is we've engaged with some really innovative recovery support activities. Really cool. One is Deprexis, it's digital therapeutics, and then the other, we're involved in a research pilot project with Wild 5 Wellness. both are really cool opportunities for our participants. The Praxis is free for all of our participants. It again is a digital therapeutics company. It works, it's for individuals who have mild to severe depression. It does not have to be diagnosed depression. They can just be experiencing depressive symptoms. It is cognitive behavioral therapy pretty much at the person's fingertips. So it's artificial intelligence. It's basically an interactive um, uh, digital therapeutics. It's very cool. You can go to their website and check it out. It grows with you. I actually went on to kind of see what it was about, and you literally answer questions about what's going on in your life, and from how you answer the questions, it gives feedback and asks more questions. It's literally therapy, which is really cool. It's a 12-week therapy program or 3-month therapy duration. And it's 100% cloud-based, so it ensures discretion and then confidentiality. And it's at that person's fingertips. It can be on their home computer, their smartphone. So we're engaging in that. And then we have a wellness study that we're working with the University of Texas School of Nursing. It's called Wild Wellness 5. It's a project that aims to study wellness practices for nurses that are in TPAPN, newly enrolled nurses. There's no obligation for them to participate. We just connect them with the study personnel, and they get a workbook. It's at no cost, and it has practices for both physical and mental well-being. And then it'll help researchers in the advancement of research regarding clinician wellness. And in the Wild 5 Wellness, it focuses on exercise, mindfulness, sleep, social connectedness, and nutrition. There's some daily journaling, a hero scale, which means happiness, enthusiasm, resilience, and optimism. So it's just very cool 30-day program that we're offering to our nurses now also. And again, any kind of wellness tools that we can offer, we are trying to just do as much research as we can to provide those tools. And we recommend it if employers can do that, would be really awesome. So, and then of course, after the nurse goes through all of this, we have that discharge piece, which we do discharge planning with the nurse and start to back out towards the end of their participation. Our hope is always for successful completion. You know, the work that TPAPN does matters because it helps nurses avoid practice violations in the workplace, which may lead to the loss of their license or employment, or even worse. So, it also helps safeguard patients from potential harm. So we really want nurses to be successful in our program. So when nurses don't complete the program, they are welcome to come back, whether it's on a board referral, self-referral. A lot of nurses who don't complete TPAPN do end up coming back at some point. And as an organization, you know, our main focus is, you know, the care of nurses and to respect the well-being of all nurses across the state of Texas. And, you know, we just desire to see that all of our nurse participants live a self-directed life and that they reach their full potential. In doing that, you know, again, a healthy, well nurse who's really just doing everything they can to take care of themselves, naturally, you're going to have a happy patient, a safe patient, a better work environment. So hopefully, I've said a lot in this webinar, so hopefully I didn't go too fast. But yeah, really, you know, we've reviewed from beginning to end what that participation will look like. And I really hope that each of you gains the knowledge that you need about TPAPN, so that if you need to make that referral, you're more comfortable with that. Here are the resources that I mentioned. That video is on the NCSBN website. That's the exact link here if you want to write that down real quick. I know it's 1 o'clock already. So if you want to write down that resource. And then these are the little flyers, handbills is what we call them. A nurse's guide to substance use disorder in nursing, and then a nurse manager's guide to substance use disorder in nursing. You can go to the NCSBN website and order these for free. And then this book is the substance use disorder in nursing book. It's a little outdated. The last one they did was in 2011. Really good information. It's a good book to have. if you're really wanting to know more about this. And, TPAPN also, not only do we use the NCSBN, we use ASAM criteria. We use a multitude of resources that are all evidence-based practices, research-based for our program. Again, if some of your questions did not get answered, you can send an email to tpapan@texasnurses.org. Just in the subject line, you can say, follow-up question from webinar, something like that. And we will answer those questions for you. I really appreciate all of you attending. Again, I hope that I was able to give you the information that you were looking for. And I hope that all of you take care of yourselves and stay well. Have a great day and happy Thanksgiving. And again, here is our website, tpapan.org, and our email address, tpapan@texasnurses.org. Thank you.